Our community update. So glad that you are joining us. I'm Angela Stepp. Would like to let you know that the information shared today will be rebroadcast here on WSOT TV at 5:30 p.m. today, and then again at 10:30 p.m. And additionally on Sunday, September the 13th at 10 a.m. and 5:30 p.m. I'd also like to say a great big thank you to our local media, the Chronicle Tribune, WBAT, the City of Marion, and the many other local media outlets that are helping to communicate this information to us throughout Grant County and beyond. Joining us first today will be Bob Jackson from the Grant County EOC. Welcome.
Thank you, Angela. Thank you, Grant County, and good afternoon. We'll get started with an update from the Emergency Operations Center. Today, as far as the numbers go, the tracking is we have 17 new cases reported today. And for the last 7 days, the average running about 15 per day with 105 for the week. The 2-week average about 13, so still way higher than what we would like to see. And there again, notwithstanding anything that I think it's too early yet to have results coming from Labor Day weekend, but we should start to see them really at any time if we're going to see results from that. So
I know last week we had spoke about the fact that there was a bit of a spike in the number of new cases, and so we are continuing then, as you have just shared, to see that trend of increase. Hopefully, though, with Labor Day weekend, folks were safe, and we won't see any more new cases increase.
We will find out in the coming days. Yes. That will tell the tale. But hopefully, that's our hope at this point.
Well, how many days have we been into this now?
182 days. We're operational period 182. So yes, we'll continue to operate. There again, review our plan every day that we meet, and just try to stay ahead of things at that point. Working in conjunction with the Grant County Health Department and all of our other partners, both city, state, federal. So we have a lot of people involved in all the activities that goes on every day.
Mm-hmm. Speaking of preparedness, I understand, as you mentioned last week, we are in Disaster Preparedness Month.
Correct. And
do you have anything new that you'd like to share with us
today? I do.
Today?
So last week we spoke about the need to have a plan. And we have some stuff on our website, and I think a graphic will come up. At grantcounty.net, you can go to and follow along with what we're doing throughout the month. So last week we spoke about having a plan, how important that is to be able to contact family members, neighbors, friends, those kind of things. So this week we want to focus on a kit, having a preparedness kit in your home, and be prepared for really anything that could happen, natural disasters, fires, flood, those kind of things. So some basic things that you want to have: non-perishable food, water, a first aid kit, battery-powered or hand-cranked radios, so that we have you can have communication from the outside, know what's going on. Flashlight, fresh batteries, local maps in the event that you have to give somebody guidance as to how to locate you and those kind of things. So that may not be from the area. Extra clothing. Medicines, a list of your medicines in that kit is important as well. The idea is that we would like to see everybody prepared to be able to stand alone for at least 72 hours. There are times when our best efforts, in a widespread disaster, it could take us up to 3 days to get to you. So if you can stand alone and be prepared and protect yourself for at least 3 days, that really is the plan at this point. And if everybody can do that, that's very helpful to yourself, to your family, and other things. So grantcounty.net, all the resources are there. FEMA has provided information on there as well. So, and we'll continue on next week with some more tips.
Very good tips. I personally have experienced a disaster, and I can tell you, those maps, those come in handy because if it's a hurricane or if it's a tornado, your surroundings, those familiar landmarks that we use to navigate, they're often not there anymore. Yeah, exactly. You might be able to find the remnant of a road sign occasionally, right. And that's always good. And I got to say, comfortable walking shoes Those disasters always happen when you least expect them. And I can't tell you, I can tell you personally, you don't want to walk in heels down roads that you aren't sure where you're at trying to navigate. It's not good. Make sure you have a comfortable pair of shoes with that change of clothes. So thank you, Bob. We appreciate the words of wisdom, and we look forward to hearing some more good advice and updates next week.
Thank you for having us.
Thank you. And joining us next is going to be Grant County Commissioner Mark Bardsley. And as he comes onto the program today, I'd also like to remind you that if you would like to call ahead to the City of Marion bus service and schedule a pickup so that you can go and vote, they are doing call ahead service 24 hours in advance. I'm going to give you a phone number. It's a local number. It's 765-668-4445. That's 765-668-4445. So that's the City of Marion bus department. You can call there 24 hours in advance, schedule your pickup, and they'll take you to get registered to vote. I believe October 5th is the deadline for that. Welcome, Commissioner Bardsley. So glad that you're joining us today.
Thank you, Angela. It's always good to be with you. And thank you again to all of our media partners who help us and get this information out to you. And thank you for your commercial on voting centers. I'm going to say a few things about that as well today. But we are in a continuing current state of emergency, and that will continue through October 2nd, according to the latest orders from the governor's office. So as we continue on, it's kind of the same old. We're getting used to all the protective things that we're trying to do. But just remember, this emergency is at least going through October 2nd. With regard to Grant County items, Angela already mentioned to us that you have the opportunity to register. Vote centers are coming. The steps have been taken to pass them, so we will have 11 vote centers that will be you will be able to vote at this year. Remember, you can vote by absentee. You can vote early voting, as well as a vote on election day. The deadline to register online is Monday, October the 5th. As well, registering by mail, you have to have that request postmarked by the 5th. And the deadline to register to in-person vote is as well October the 5th. The deadline to request a ballot so that you can do that by absentee, that last day is October 22nd if you need to do that absentee. Early voting periods do open October the 6th and go all the way through November the 2nd for early voting. If you have questions about voter registration, questions 664-9880, and that'll get you to the elections office and voter registration for any type of questions that you have. With regard to COVID testing, still in Grant County, Optum Health is still doing that on behalf of the state of Indiana, and that is located at the Clarence Faulkner Center. What you need to do if you're interested in taking a test is you can go online to https://lhi.care/COVID testing, and they can sign you up there, or you can call a toll-free number 888-634-1123. And if you call that number or you go online, they will register you, get you a patient number, and you have to have that number when you go to your appointment at the Clarence Faulkner Center. And that is at least through the end of this month that is available. Something else that I did want to talk about is we're moving forward on our central dispatch. We're still working out some of the glitches, but we are taking our calls. We are working on response and response times, and working to come up to a full staff. We've still been short with some of our employees, and so some of our employees are actually having to work overtime just to keep the 24/7 operation going. We are stabilizing that, and we're just about to full staff now, and we're excited about what's happening there. As well, the news has reported that we're having the tower project in which public safety is going to be able to communicate more adequately for first responders and public safety. And so we're actually talking about a tower in the city of Marion. Right now, all communication is going through a tower that is north of the city of Marion, and leaving most of the southern region of our county very low or unable to communicate via radio for public safety. So we're working on that project, and we're talking more and more about that at the city level, at the county level, and we're excited about those possibilities. So let's talk about a snapshot of where we are right now in the state of Indiana. Most of you, if you're following at all, a total of 1,559,000 Hoosiers have been tested thus far. We're moving to about a third of the population in the state of Indiana that has been tested. With that testing in mind, over 100,000 confirmed positive cases since March 3rd have happened. As a result, we have had 3,156 Hoosiers that have died because of COVID. Now, what I want to just reinforce here with some of these statistics is that we were asked to slow the curve, to keep that wave down, to help not let it spike during the first part of this COVID pandemic. And I think we've succeeded in doing that, to the point where Indiana is reporting that 43% of our intensive care unit beds are not being used at all, and a very low percentage of all of our beds, about 10% or less, actually are being used for COVID at this particular time. That's great. As well, 82% of ventilators in the state of Indiana are not being used at this point, which means we do have the healthcare resources that we need in case we spike again. But we have been controlling it through the things that we've asked you to do, wearing our protective personal gear, our masks, our safe distancing from one another, as well as that personal hygiene. And it's very important. If you want to continue to be in tune with what's going on, you can go to coronavirus.in.gov and continue to watch what's going on with the government, state of Indiana. Statistics yesterday in Indiana, I was looking at it. I think it's very interesting, and it's important for us to realize the total number of that 1.5 million Hoosiers that have been tested. A large majority of the testing actually has been done in the younger population. A lot of the teens, the 20s, and 30s are going in. When it comes to those in their 60s, 70s, and 80s, only about 24% of that group that was tested were the older population. But if you look at the statistic, and it's always been something that I have looked at, the mortality rate, 91% of the deaths of that 3,100 in the state of Indiana are from the 60s, 70s, and 80s. And so our emphasis needs to be on taking care of our people who are at risk with their health. It's very important. We always need to be vigilant in what's going on. I've seen a lot of folks that are starting to be lax, and yet we're seeing kind of an uptick on folks that are reporting positive cases. We cannot let our guard down now. So those that are greatest at risk, those who are in their 70s and 80s, that we just want you to be careful. We want you to make sure you're masking up if you have to be out. You're using that physical distancing that will protect you from getting those particles that are often spread by close contact. So, firm attitudes, stable dispositions, and good habits govern our actions, order our priorities, and guide our conduct according to reason and faith. Scripture says that faith, hope, and love are the things that hold on to. It specifically says, now abides faith, hope, and love. The greatest of these is love. I want you to keep not only taking care of yourself, your family, loving your community, supporting your community, but keep doing what you've been doing. We're seeing success because we're working hard at it. Keep those masks on when you're in public, distance when you need to, and keep that personal hygiene going. I just want to remind everyone, a couple weeks ago I said, our pastor said, our current reality is not our final destination. And that's very important. We're going to get through this as we continue to work together, be strong together. So as always, be steady, be safe, and be strong. Thanks, Angela.
Thank you. Valuable information. Always appreciate the statistics and the insight that he brings to us. So glad that Commissioner Bardsley is joining us. Up next is going to be Dr. David Moore from the Grant County Health Department. Welcome, Dr. Moore. So glad that you're here today.
Thank you, Rich.
Now, I have a question. I know everybody is focused on the statistics and the circumstances surrounding the COVID-19 outbreak and the uptick in cases that we're seeing. Would love for you to have a chance to speak to that. But then also, because there's other health concerns outside of COVID that we're all aware of, September, Marion Mayor Jess Allenbaugh has declared September to be Ovarian Cancer Awareness Month. And I think that you are very capable to address that as well. So would you please share with us insight that you might have pertaining to COVID, and then also just speak to us on the awareness aspect of ovarian cancer?
Thank you. Again, this has been COVID has kind of dominated us, but it isn't the only thing that's going on. I want to echo the things that the others have said, both the good and the cautions, that we in Indiana are not as bad as some of the others that have been there, especially thus we're here in Grant County have done in terms of our deaths and serious hospitalizations have done well. Recently, we've noted an uptick. If we go back to what was going on when we quieted things down and looked to open up the state, our numbers are 2 or 3 times higher. Many of those are in young people who are transmitting it, but we want to be careful that we don't let fatigue be the same as it's now over and we can go to another way of doing.
True.
We're looking for that new normal. And the most important elements in the new normal, along with testing and knowing where it is preventing droplet spread and having a social distance that's safe with that. Those are simple words to say, but the logistics of how you put it together and what we have to do when there's a need to isolate someone who's infected and to quarantine those who've been affected by it are very complicated. And to know that the numbers that were picked kind of, this is a general number. It is a constantly ongoing thing as we both understand the nature of the disease and how it affects people and which of our plans in terms of mitigating and lowering the risk are effective and which of them really don't. What are the key elements that we need to do and what's the cost of doing those things versus the benefit that we get. And some of them are important to recognize that 2 kind of general sets of population are there. One are the ones who may transmit it. And we opened up the schools and we had holidays and the numbers exploded. And those are the ones who may get it and may not, as much as we know, suffer as much. And then those the elderly that are there. And we're starting to see an uptick in the number of hospitalizations and concern that we may start to see in that vulnerable population deaths. So that when you're doing it, when you're taking care of yourself, when you're wearing the mask, when you're doing the social distancing, it isn't just for you. It's for the whole community. It's for grandma, grandpa, for the other ones who are there, who have wonderful years ahead of them if we can avoid them getting hit by COVID. So
I'm so glad that you point that out, because I think there are so many people who, we want to protect ourselves. And I've heard, folks declare statements, if masks work, why do we have to mandate them? Those sorts of questions. But at the same time, I think it's important to key in on what you just said, and that is, while it helps you, you are also helping to protect others, because you could be an unknown carrier. And it may not affect you. You may not even be in an at-risk category, but you may come in contact with people around you who are. Yes. And so it's a courtesy to your neighbor to wear the mask, to take those steps, to be proactive and try to help prevent the spread, which you have shared and Bob Jackson have shared. That is something that is measurable, and we can see that it is making a benefit to everyone when we do use the mask.
Thank you. And the majority of people who contract COVID, we believe, are not infected by people who have obvious symptoms. They're contracted by people who are, they get it from people who are asymptomatic. So being careful. And since it often is asymptomatic in some people, or early in the stage of it, that you can still contract it, until we find a new solution, till we find other things, we have to go for the new normal.
Mm-hmm.
Now to the thing that you did ask about, the
Yes.
ovarian cancer. And as you know, and as some of the others know, that by training I am an obstetrician gynecologist and women's health care and in childbirth. And it's something that I've spent 40 years of my life practicing before I came to a limited practice in the office and to the health department doing that. Ovarian cancer, female cancer are very important and very important to taking care of women. The breast cancer, one of the top number of cancers that we have, hit women in their early perimenopausal years and in the menopausal years. Particularly, ovarian cancer is one of the rarer cancers that we have. It hits that age group a little bit earlier without necessarily any early warning signs. There are some predispositions, genetic predisposition. There's a gene, just like there's a breast cancer gene that makes women prone to that. There's a gene mutation that may make a woman more prone to that. Family history of it, use of medications that stimulate the ovary to work more may increase that. Medications that help to reduce it are birth control pills because they put the ovary at rest. Pregnancy, breastfeeding seems to do one of those. Because it is early detection that is so important, and it often doesn't have clear symptoms, it means that regular checkups are important. That early detection, finding it when it's at a stage where you suspect something may be going on and you contact your physician, and then your physician pursues that with you. And in line with that, your doctor is not your dictator. Your doctor is your partner in your health care. So that it's important that you have a conversation in which it is two ways. And if you have a concern, that you want your doctor to hear that and you want to stay with the doctor to do that. That can be done respectfully, and that's not wrong to do it. That's important to do. That's essential to do. Not just as it relates to ovarian cancer, but all of your health care and all of the things that you do, that you're an active and informed partner in taking care of yourself. And for those of us guys who know that you ladies are what makes the world go around, and taking care of yourself is the best way to take care of our whole community.
I thank you so much for that, and I really liked what you just said, that your doctor is not your dictator, your doctor is your partner, and that you have an active conversation, you have a role in your health care, and I really appreciate that you have empowered women throughout your career to be able to be advocates for their own health and well-being, which does help everyone around.
Okay.
Thank you, Dr. Moore.
Thank
We
you very
appreciate
much,
you.
Angela. Thank you.
And joining us next will be Superintendent of Marion Community Schools, Dr. Brad Lindsay. And I am excited that he is here, and I would love to hear what kind of giant news you have for us today.
Thank you, Angela. In our COVID update, what I'd just like to encourage everyone is our Marion Community Schools website. So you've heard me say that, but we're working diligently to update every single day. We've got excellent local media and our websites. Those are your informations for truth. Thank you for this opportunity here today. But we're asking everyone to check it. And I also want to compliment our team. We're experiencing a great start to the school year. Sue Nicholson, our lead nurse, working so faithfully in close contact with Dr. David Moore and Amber Turner of Grant County Public Health, and all of our nurses, our principals, teachers, and teams. They were working faithfully. And so as we're understanding the protocols and procedures, and when information comes up, we will communicate, and we have been, and we will continue to do so. Our team is serving well. Just let me say, a decade ago, I think people out there thought, what do you mean Marion High School is going to start at JROTC? How are you going to get a bunch of high school students to really think about community and service and leadership and duty and honor, to wear uniforms and to show up early and to stay late and to be that kind of an example? Well, I think our students showed that it can be done as our JROTC is thriving. And with them, there's such a hope for the future. But also, pre-COVID, I bet people thought, how would you have all those protocols and procedures of orderly with high school students and junior high students and intermediate school students? It is happening. Our environments are so peaceful. We're following protocols. We're following a plan. We're taking things serious. And as a result, we have limited the number of COVID positive cases we have among staff and students. In fact, since July 6th, we're looking at about 6 COVID positive staff and 5 students. And we have limited through the contact tracing the number that would be necessary at risk that would need to quarantine. So I'm thankful for the whole staff. We're proving that it can be done. We are experiencing an excellent partnership with our local Grant County Public Health. Dr. David Moore, excellent leadership. Nurse Amber Turner, excellent leadership. The communication, the execution is excellent. I'm so thankful. Also with Bob Jackson, Emergency Management, excellent leadership for entire county, and Commissioner Mark Bardsley from our county. See, we got our county commissioners and all of us locally working faithfully to serve the people of Marion. And I'm telling you, you can have great confidence. My ask in regards to state public health is support us, let us do our jobs. What I mean by that is we know our people. And so schools, we're in contact with our families and our staff and our students, and we're contacted with Grant County Public Health. That's an excellent communication. But I'd ask for better communication from the state when it comes to the execution of this, and just support us, because we live here, we serve here, and we are going to faithfully serve our people well. I've got full confidence with local county and our schools working together to appropriately serve our families. And then what I'd like to end with today is just all the positive production that I'm seeing in Marion Community Schools. More and more of our giants are coming back on campus because it is early. Many that were giant online are coming back on campuses, and we're excited about that. So now we have just excellent class sizes on campus, but also now our class sizes on online are very doable. We like the opportunity for our families to have both choice, so we want to meet the needs and preferences. So we want both the online and on campus, but it's so good to see so many of our giants coming back. And what we're experiencing is that giant nation culture of achievement motivation and academic acceleration. You know, when you got that right peaceful environment, when you've got a plan and you're executing that plan, that creates that optimal environment. Just like the optimal partnership with local Grant County Public Health, we have that optimal learning environment that we are experiencing, the best I have ever seen in over 30 years in my 8 years at Marion Community Schools. My over 30 years in education and 8 years at Marion Community Schools. So I'm thankful for that. Here's the giant way that we want for all of our students and our staff and all of us. The will to learn, the will to earn, the will to give, the will to live. That is the culture that we have at Marion. That's the giant nation culture. It's a culture of the giants fight, never die, of grace and grit. Giants fight, never die work ethic. Giant pride, achievement motivation. Giant pride, academic acceleration. And they continue to plan with a purpose. Planning, protocols that everyone's talking about here today for all of us in the county. Proper procedures, and then execute those procedures. And that leads to great peace. And peace leads to positive productivity. That's the Marion Giant way. I want to say thank you to our students, staff, and families of Marion Community Schools. I want to say thank you to the community of Marion and Grant County. And I'm telling you, our best is yet to come.
Thank you, Dr. Lindsay. And, the best is yet to come. It'll be very interesting to see the insights as we step back in 2021 and take a look in review at 2020 and see what we can glean from this experience that we have all gone through together. Well, I want to let you know that today's information is going to be re-aired here on WSOT TV at 30 p.m. and then again at 10:30 p.m. and also on Sunday, September the 13th at 10 a.m. and 5:30 p.m. Thank you again to the local media that are helping to communicate this information, the Chronicle Tribune, WBAT, the City of Marion, and the many others. That's all that we have for today. Stay tuned for some more quality family programming that you can trust right here on Sunnycrest Outreach Television.